Hi guys, hope everyone's doing well and getting ready for the holidays. My name is Dr. Ahmad. I'm a periodontist working in Toronto in Canada. In today's video, I'd like to talk about peri-implantitis and I'll present a few slides on this topic. Specifically, I'd like to talk about treating periodontal disease prior to placing any implants. On a daily basis, I see numerous implants with peri-implantitis that have been placed by different practitioners. I don't want to pick on specific specialists, but I've seen them placed by even periodontists, by prosthodontists, oral surgeons, general practitioners. So it's done by a number of different clinicians. We know for a fact that active periodontitis is directly correlated with developing peri-implantitis. Even history of periodontitis is related to or basically correlated with peri-implantitis. And patients that have active periodontal disease, that's even worse. So that needs to be treated before any implants are placed, because if not, then we're really not helping our patients. So its implants are going to look good in the short run, but eventually they're going to develop severe bone loss, pocketing, suppuration, and potentially implant loss, which we don't want our patients to go through. So please, next time when planning on placing an implant, take a moment, assess the dentition, assess the periodontium, making sure there's no pocketing, not just the adjacent teeth where you're planning to place the implant, but the whole dentition, and making sure there's very minimal bleeding on probing before attempting to place any implants, because if that's not treated, then we're really not helping our patients. So please, if you have any questions, let me know down in the comments. If there's any topics you'd like me to cover moving forward, please let me know. And I hope you guys learned something from this video. Thank you again for watching, and I'll see you guys soon.
So the first thing we have to do is classify peri-implant diseases. There's peri-implant mucositis, and then there's peri-implantitis. And we can think of it as similar to gingivitis and periodontitis. So in peri-implant mucositis, the inflammatory lesion is basically surrounding the implant, peri-implant mucosa, without any loss of bone. However, in peri-implantitis, it's a pathological condition. You have inflammation in peri-implant mucosa in addition to progressive loss of bone, and marginal bone loss, as seen radiographically, is a distinctive feature. Now we have to define peri-implant health, and that is basically an implant which lacks any distinctive features of inflammation. That includes bleeding on probing, visual signs of inflammation such as swelling and redness. In the 2018 World Workshop, the consensus report stated that there is strong evidence that plaque is the etiological factor for peri-implant mucositis, and that the lesion can resolve after reinstitution of plaque control. And we know that peri-implant mucositis is a precursor to peri-implantitis, so the sooner it's treated, the better the outcome. There are numerous studies that show where bleeding on probing is a poor predictor of future bone loss. The absence of bleeding on probing is a very strong indicator that the marginal bone will be preserved and you won't lose any bone. And this is similar to teeth. We know that when there's bleeding on probing around teeth, that doesn't necessarily tell you much regarding attachment loss or bone loss moving forward. However, the lack of bleeding on probing is a strong indicator that there won't be any bone loss or attachment loss. The prevalence of this disease, there was a meta-analysis done by Dirks and Tomasi in 2015, and the prevalence of peri-implant mucositis was 43%, and for peri-implantitis it was 22%, and those are pretty high numbers. The etiology of peri-implant diseases, there are different schools of thought. The main cause, looking at studies, they all say that it's plaque. Basically, there are data showing that there's a cause and effect relationship between plaque and development of peri-implant disease. Accumulation of plaque in implants in humans was allowed to occur over 21 days. This was done in numerous studies. And during this period, peri-implant sites consistently developed visual and other signs of peri-implant mucositis, that is swelling, redness, and bleeding on probing. This inflammatory condition, it can be reversed, and it was reversed in these studies when plaque control was reinstated over an additional 3-week period. So this is why these studies are basically showing a cause and effect relationship between plaque and peri-implant diseases. And Jepsen in 2015, or Jepsen, they showed that peri-implant mucositis is the precursor of peri-implantitis, and it is reasonable to consider plaque as the cause of peri-implantitis. A review of the literature, if you look at the studies that have been published so far, there are numerous studies that show presence of periodontitis, or the history of periodontitis constitutes a risk factor for peri-implantitis, and there's strong evidence for this. And we won't be getting into each and every one of these studies, but for those of you that are interested, these are the references. The other main factor or cause of peri-implantitis is poor plaque control or lack of compliance with maintenance visits. And both of these were basically strong risk factors which were mentioned in the 2018 World Workshop by Schwartz. And also, Ferreira in 2006 showed that patients with very poor oral hygiene are at statistically significantly higher risk of developing peri-implant mucositis and peri-implantitis compared with patients with proper biofilm control. And there's a direct cause and effect relationship between a 3-week period of no oral hygiene practices with biofilm accumulation and development of peri-implant disease, as we discussed before. And also, there's been a study that showed in patients with high biofilm scores before implant placement, they experience more implant loss compared to patients who have better oral hygiene and minimal plaque around their teeth. So again, this I wanted to basically make this presentation to show that there is strong evidence linking periodontal disease with peri-implantitis. So please make sure before you place any implants that periodontitis is treated first, because if not, as we can see in a number of studies, there is a very high risk of developing peri-implantitis around the implants that are placed in patients who have active periodontal disease. So if you have any questions, please let me know in the comments below. Hopefully this was useful, and moving forward, again, if there's any topic you'd like me to cover, just let me know. Thank you again for watching, and see you guys soon.